Good morning, and thank you all for being here. And thank you to Ellie and JJ for being here, and thank you to my cabinet for being here. When President Trump was elected, I said that I was willing to and looking forward to working with anybody to accomplish good things for the people of Rhode Island, and that is still the case. I am ready, willing, and able to work with anyone who is going to help Rhode Islanders and put our people first and move our state forward. I also said that I would speak out forcefully if I thought that the president's agenda or anyone's agenda would hurt the people of Rhode Island. And that is exactly why I called this press conference today. This is much more than politics. Trumpcare will hurt many people in Rhode Island. Lives are literally at risk, and I felt it necessary to speak out about that, which is why I'm here this morning with fellow Rhode Islanders and with my health cabinet. The simple fact, which I've said many times, is that by and large, the Affordable Care Act is working here in Rhode Island. Hear that loudly and clearly. The Affordable Care Act is saving lives in Rhode Island. And Trumpcare will hurt thousands or tens of thousands of people in Rhode Island. And we have to stand up against this to protect our friends and our family and our neighbors and our Rhode Islanders. 110,000 people in Rhode Island, 110,000 of our friends and our family and those around us have health coverage because of the Affordable Care Act. We have 96% of Rhode Islanders who are insured. It's almost full coverage. Private insurance premiums have increased 6 to 10% in recent years, which is a great credit to you and your work. On our exchange, Affordable Care Act plans have been flat. Premiums have been flat. In fact, they're the lowest in the nation, and some have actually decreased. The premiums for plans on the exchange have actually decreased in the last year. Working with my team and the General Assembly, that deserves great credit, we've also done a lot of work around reinventing Medicaid to keep a lid on costs, while also insuring more people. 70,000 Rhode Islanders have health insurance through the Medicaid expansion. And all the while that we've been insuring tens of thousands more people through Medicaid and the Affordable Care Act, because of the work the Assembly and I and my team have done, we've saved over $100 million for taxpayers in Rhode Island. So, again, when I say the Affordable Care Act is working, just look at the facts. 110,000 people have coverage, keeping a lid on the cost of premiums, the exchange is working, premiums on the exchange are flat or going down. Trumpcare puts all of that at risk. It puts our fiscal situation at risk, it puts the lives of tens of thousands of Rhode Islanders at risk, it puts the hard work of the past several years at risk. Why? All for the cause of giving tax breaks to the wealthiest Americans. That's why. There's no other reason to do this. Why would you break something that's working and saving lives? It's wrong, and we shouldn't let it happen. I want to go just for a few more minutes into the details of how I think Rhode Islanders will be hurt and who will be hurt. As I said, individuals will be hurt. 70,000 expansion, 110,000 getting coverage. People who have coverage now through the health exchange are going to have to pay higher deductibles, higher out-of-pocket cost. Your medicine will be more expensive. Seeing the doctor will be more expensive. Buying insurance will be more expensive. Low-income Rhode Islanders and older adults who are not yet eligible for Medicare, are going to see their premiums increase and subsidies decline. You could see cost increases of thousands of dollars a year for folks in that category. Overall, estimates show, my team and I have been working rapidly to figure out the precise impact. Overall, premiums could increase by as much as 20% in 2 years. Rhode Island women could lose access to full health care services. Thousands of Rhode Islanders, over 2,500 Rhode Islanders who currently get treatment for opioid use disorder through Medicaid could lose their coverage. I've spoken many times about the fact that every day, we lose Rhode Islanders to the overdose crisis. It's getting worse, not better. We're doing everything we possibly can to save lives. We have thousands of people who have overdose issues, who have opioid users. We are beginning to see success using Medicaid. This will roll back this success and put people's lives at risk. I also believe hospitals and doctors will get hurt. People are going to see out-of-pocket expenses go up, subsidies go down, premiums go up. Hospitals are going to see their uncompensated care go up. For the past couple of years since the Affordable Care Act, every hospital in Rhode Island has seen a substantial drop in their uncompensated care. That's good news. It's good news for the hospitals, for the patients, and the thousands of people that work at those hospitals. That could all come to an end. As uncompensated care goes higher, as it was, hospitals get hurt, and layoffs are inevitable. Some estimates that I've seen suggest that as much as 8,000 Rhode Islanders could lose their jobs because of Trumpcare. That's undoing much of the job growth that we've seen. And I've heard from hospitals, and I've heard from doctors. There's only a few ways to save costs in the system. Cut people off of insurance, increase the amount that people pay, or pay providers less. Trumpcare does all three. All in the name of giving tax breaks to the wealthiest Americans. Our congressional delegation, and some of their representatives are here today, and I appreciate that. Our congressional delegation obviously couldn't be with us today because they're doing their job. They're in Washington fighting for the people of Rhode Island. And I want to thank them, both our senators and our congressmen, for doing their jobs, for standing up for Rhode Island, and doing everything they can to make sure that Trumpcare doesn't become the law of the land. I also want to indicate, many people have said to me, what's the fiscal impact on Rhode Island, in addition to hurting people, hurting families, hurting our hospitals? This, depending on how this goes through Congress, this could cost Rhode Island taxpayers more than $200 million a year to maintain the coverage that they have under the Affordable Care Act. We can't afford that. We're in a budget deficit. We're coming out of it. We're doing better. We've taken steps. We cannot afford a $200 million bill. Quite frankly, we shouldn't have to, because the federal government should continue to provide this. So, why am I here today? Because this matters to the people of Rhode Island. The message to President Trump, the message to the Congress, the message to Speaker Ryan is that the Trumpcare plan is wrong, it's not moral, it's not right, it's not necessary, and we, the people of Rhode Island, will be harmed if it's passed. Our providers will be harmed, our hospitals will be harmed, people will lose jobs, it'll cost us hundreds of millions of dollars that we can't afford. But most important, it puts the lives of Rhode Islanders at risk. That isn't an exaggeration. There are people, I hear from people, in the time since President Trump has been elected, not a week goes by that I don't meet people, as I'm out and about, who say to me, Governor, can I keep my health insurance? Will I be able to keep my health insurance? Will I be able to continue to get my medicines? Will I be able to keep going to my doctors? The answer to that question is no if Trumpcare is passed, and we cannot let that happen. So I'm here today on behalf of the people of Rhode Island to say the Affordable Care Act is working, and let's keep it intact so we can save lives and continue to improve our economy and continue to stay on path. I'm happy to answer any questions, but before I do that, we have two incredible Rhode Islanders with us today, Ellie and JJ, who are just who have come forward very bravely to share their personal stories about how the Affordable Care Act has helped them, and how a repeal could potentially hurt them. And I want to invite Ellie to say a few words.
Thank you, Governor.